Good evening. Welcome to the National News Broadcast. I'm Kasuni Balachandran.
And I'm Tarak Ityarachi. First, to look at the stories making the headlines around the world. The number of confirmed COVID-19 infected patients rises to 174. Curfew will be lifted for 8 hours from 6 a.m. tomorrow, except in the districts identified as high risk. 279 individuals complete their quarantine period. The Saubhagya Gevatta cultivation program gets underway. France reports of the highest number of deaths within the past 24 hours. And now for those stories and more. The epidemiology unit states the number of COVID-19 infected persons in the country has risen to 174. 279 individuals have completed their quarantine period and have been discharged so far. 378 individuals were taken into quarantine. 5 confirmed cases were reported today. So far, 29 patients have been discharged from their hospitals upon full recovery. 5 COVID-19 related deaths have been reported in the country. 137 persons who contracted the virus are still undergoing treatment at the IDH hospitals, the Valikanda Base Hospital and the Mulleriava Base Hospital. Medical investigations are underway into another 259 persons suspected to have contracted the virus. Currently, the highest number of confirmed cases is reported from Colombo district. Upon completion of the quarantine medical observation, 3,169 persons have been discharged and sent to their homes. 40 quarantine cases are operational across the island. The Sri Lanka Air Force is operating 2 quarantine centres, while the Navy is operating 1 centre. The Army is operating 37 quarantine centres. The 279 individuals who completed their quarantine period today were from Jaffna and Kundasale quarantine centres. 46 individuals from the Kundasale quarantine centre were discharged. They are individuals who arrived in the country after the Dhammadevya pilgrimage. Army Commander Lieutenant General Shavendra Silva said that they are also advised to undergo a 14-day self-quarantine period at home. The Army Commander points out that this is important as an individual was identified to have contracted the virus within less than 7 days after the completion of the 14-day quarantine period.
සෑම ප්‍රවෘත්ති සාකච්ඡාවකදීම අපි නිරෝධායන ඉවර වෙලා යන කට්ටිය ගැන කියලා ඒත් එක්කම හැම වෙලාවකම අපි කියලා තියෙන්නේ තව දින 14ක් ඕට නිරෝධායන කටයුතු වල නිලෙන්න කියලා. ඉතින් අපි බලාපොරොත්තු වෙනවා මෙතෙක් නිරෝධායන මධ්‍යස්ථානවල නිරෝධායන කටයුතු නිම වෙලා ගිය අයවලුනුත් ඒ වගේම ස්වයං නිරෝධායනවල හිටපු අයලුන්ගෙමුත් ඉල්ලනවා තව දින 14ක් තව දුරටත් ස්වයං නිරෝධායනයක යෙදෙන්නයි කියලා. දුරකථන අංක හරහා මේ වන විට 43500
Senior DIG Ajit Rohana says around 43,500 individuals have registered over the phone for self-quarantine since the 11th of this month, out of which around 18,000 individuals have completed self-quarantine, whilst around 25,500 individuals are currently undergoing self-quarantine. Restrictions imposed on the entry to and exit from the Akurana area in Kandy after the detection of several COVID-19 infected persons are still in force. A group of individuals who did not properly comply with the self-quarantine guidelines have been directed to the Poonani quarantine centre. Meanwhile, the Akurana town and the surrounding areas have been disinfected yesterday. A COVID-19 infected patient was detected in the Panipiti area on the 3rd of this month. The Sri Lanka Army states a group of 45 individuals who had close interactions with the infected patient were sent to the Poonani quarantine centre today. A husband and wife had been admitted to the Kalubowila Teaching Hospital recently for treatment. As a suspicion arose that the couple may have contracted the COVID-19 virus, they were transferred to the Homagama Base Hospital. In the medical investigations which followed, it was confirmed that the wife had contracted the virus. Her husband has not tested positive for the virus. However, he has been retained in the same hospital for further medical investigations, as it is suspected that he may have also contracted the virus. Meanwhile, all entry points to the roadway along which they resided, Sri Janamavata at Attiliya, have been temporarily closed, and all residents of the area have been sent to quarantine. Several COVID-19 infected persons were detected in Pannila and Chinakotua areas in Beruvala recently. Today, jointly with the medical staff of the Kalutara District Hospital, samples were obtained from a number of individuals and children who had closely interacted with these infected persons. The samples were sent to the Medical Research Institute to confirm as to whether these individuals have contracted the virus. A COVID-19 infected patient was also detected in Navatuduwa in Matugama yesterday. 8 individuals who had close interactions with this patient were sent to Kandakadu quarantine centre at Polonnaruwa today. The Alutgama area in Bandaragama placed in isolation with effect from the 27th of this month, and the measure is still in effect.
And in other news, the Saubhagya Gevatta Prosperous Home Garden initiative is proceeding with the distribution of seeds required for home gardening. With the worldwide spread of the COVID-19 virus, the farmlands and their food production in many countries face a serious risk. The government, taking the situation into consideration, took steps to popularize the cultivation of 14 types of crops in the country upon the recommendation of the Task Force on the National Food Programme. Packets containing 5 types of seeds and saplings were handed over to Minister Bandula Gunawardena today under the Saubhagya Home Gardening Programme. 30 selected home gardens per Grama division are being cultivated under this project, which hopes to create 1 million home gardens throughout the country. Minister Bandula Gunawardena said the government is providing 5 types of seeds for a concessionary price of 20 rupees, whereas the market price of these seeds is between 150 to 180 rupees. Minister Gunawardena says if the corona outbreak is transformed into a cultivation outbreak, this catastrophe can be converted into a resourceful asset. The distribution of seeds for 6,000 home gardens in the Ampara district took place in the Navagampura Grama division at Ampara today. Seed packets were also distributed with the assistance of agrarian service officials in the Hatton area today. Cultivations in the lands of the Mirisavatia sacred site at Anuradhapura are continuing, and now the harvest is being reaped. The required fertilizer is being produced through compost that is produced utilizing the waste in the premises of the sacred site. Home gardening has commenced in 35,000 gardens of families whose chief occupant are females in the Anuradhapura district. They will also receive seed packets next week. Farmers in the Polonnaruwa district are also preparing their lands for cultivations these days. Residents in the Valikanda, Timbulagala, Medirigiriya, Lankapura, Alahara, Hinguragoda and Samankadua divisional secretariat zones have joined in the project, which will grow maize, cowpea, green gram, green chilies, raw turmeric and vegetables.
An update on the curfew conditions, except for the districts which have been identified as high-risk zones in terms of the spread of the coronavirus. Curfew will be lifted in the other districts at 6 a.m. tomorrow and will be reimposed at 2 p.m. on the same day. The high-risk areas in which the coronavirus has a potential of spreading are the Colombo, Gampaha, Kalutara, Puttalam, Kandy and Jaffna districts. The imposed curfew in these districts will be effective until further notice. Movement between the districts when curfew is imposed is totally prohibited except for essential services. The law will be strictly enforced against those found misusing the measures put in place to carry out essential services efficiently. Steps have been taken to facilitate the public with door-to-door sales of essential food items and other commodities when curfew is in force. Those involved in farming and the cultivation of tea and other export crops can continue with the agricultural activities, as the imposed curfew will not be an obstruction. Senior DIG Ajit Rohana says curfew is lifted occasionally for the public to avail essential services. However, no permission or approval will be granted for any individual movements from their places of residence to other locations. He emphasizes when the curfew is lifted, the public should only head towards the relevant outlets that provide consumer services. The senior DIG warns that under quarantine and disease prevention ordinance, the police have the power to make an arrest for curfew violations even when curfew is temporarily lifted. The senior DIG also advises the public against posting content on social media which hinders the quarantine process. He pointed out a woman who has spread such disinformation was arrested in Panadura area today. Senior DIG Ajit Rohana, the CID, carried out an investigation into the incident, and a woman who concocted a statement and released it to the internet was arrested by the CID in Wadua area.
විමර්ශනයේ ප්‍රතිඵලයක් හැටියට අසත්‍ය ප්‍රකාශයක් නිර්මාණය කර ඒ අන්තර්ජාලයට මුදාහරන ලද තැනැත්තියක් පානදුර අද දින අපරාධ පරීක්ෂණ දෙපාර්තමේන්තුව මගින් වාද්දුව ප්‍රදේශයේදී අත්අඩංගුවට ගන්න. Health
Minister Pavitra Vanniyarachi says even though curfew is occasionally lifted, the public should take precautions during that period to prevent the coronavirus from spreading. Minister Pavitra Vanniyarachi says the government is taking steps to contain the spread of the virus at this stage before it spreads throughout the country. However, considering the requirements of the public, the minister said that the imposed curfew will be lifted in several areas. She calls on the public to adhere to guidelines when curfew is lifted in order to prevent the spread of the virus.
ඒ වෙලාවේදී අපි මේ රටේ ජනතාවගෙන් ඉල්ලා හිටිනවා. ඔබ මේ රෝගය පැතිරීම වළක්වීම සඳහා ගත යුතු සියලු ක්‍රියාමාර්ග අනුගමනය කරන්න.
Meanwhile, issuing a release, the President's Media Division states that the week from tomorrow to this Friday has also been declared a work from home week for both government and private sector. Just yesterday, 1,245 individuals were arrested for violating curfew regulations, whilst 336 vehicles were seized by the police. Thereby, from the 20th of last month until today, 13,716 curfew violators have been arrested, while 3,423 vehicles have been seized. When observing the curfew violations, over the past 10 days, there have been 6 consecutive days in which the number of arrestees have exceeded 1,000 persons.
The Mahasangha states that they condemn attempts made by certain individuals in the opposition to gain political mileage at this time of crisis. Several prelates have expressed their views in response to former parliamentarian M.A. Sumandiran's call for the now dissolved parliament to be reconvened.
Today, there are more than 30 members here on this side of the table. On that side of the aisle, there are another 30. More than 60 people have come together in the hall here. For Parliament to convene, you need only 20 people. The quorum is only 20. So, it's important because several have already said that people's representatives' involvement in this is absolutely essential. We are not people's representatives today. We are former representatives.
Parliament
Anunayaka of the Askariya chapter, Venerable Vendaruwe Upalithara says, at this moment what is needed is not convening Parliament and obtaining political views, but paying adherence to medical guidelines. Chief incumbent of the Sithul Power, Rajamahaviharya, Venerable Mittaramba Hemaratna Thera says, what they can observe is a situation somewhat like bringing about a disastrous situation for the country and the entire world by putting forward unnecessary and confusing sentiments by calling for Parliament to be reconvened, whereas the possibility prevails for any problem to be negotiated and solved.
The Special Presidential Task Force states the Elders Allowance, the Senior Citizens Allowance for persons over 100 years, and the Disability Allowance and the allowance paid for kidney patients will be paid tomorrow. The payments will be made through the respective Grama Niladaris. Minister Pavitra Vanniyarachi says the government, together with the head of the relevant task force, Basil Rajapaksha, upon the instructions of the President and the Prime Minister, has decided to pay 5,000 rupee allowance to all beneficiaries tomorrow. The allowance will be delivered to their doorstep by the relevant Grama Ninadari. The Minister further states, in addition, steps will be taken through the appointed committee to grant this concession soon on behalf of those who have no source of income due to the loss of their daily earnings. This measure will be taken with effect from 7th of this month.
ජීවත්වීමට අපහසුතාවයක් පත්වෙන අනික් ජනතාවට පත් කරන ලද කමිටු හරහා ඒ සහනාධාර 7 වෙනිදා සිට ඉතා ඉක්මනින් ලබා දීමටත් රජය කටයුතු කරගෙන යනවා. ඒ නිසා අපි ඔබෙන් ඉල්ලා හිටිනවා යම් යම් දුෂ්කරතාවලට ඔබට මුහුණ පාන්න වුණත් මේ රෝගය මේ රටේ තුරන් කිරීම සඳහා රජය ගෙන යන වැඩපිළිවෙලදී ඔබේ සහයෝගය ලබා දෙන ලෙස.
The disability allowance of 5,000 rupees will be paid tomorrow for beneficiaries currently receiving the allowance and those who are on the waiting list. 72,000 individuals are entitled to receive this allowance, while the number of persons on the waiting list is 38,491. The 5,000 rupee allowance for kidney patients will also be paid tomorrow for 25,320 kidney patients, of which 13,849 are on the waiting list, bringing the total number of beneficiaries of the kidney patients allowance to 39,169. An additional 3,000 rupee allowance will be granted for senior citizens over 70 years who have already received the 2,000 rupee allowance, elders allowance rather, for this month. Thereby they will receive a total allowance of 5,000 rupees for this month tomorrow. In addition, steps have been taken to grant 5,000 rupee allowance for senior citizens over 70 years who are currently on the waiting list. All these allowances will be delivered to the residencies of the beneficiaries of the relevant Gram Nirdaris tomorrow. All steps have been taken to pay the pensions of farmers and fishermen. Chairman of the Agro Insurance Board, attorney at law, Premachandra Appa, says steps have been taken to pay these pensions from the 6th, 7th and 8th of this month through the respective post offices. Meanwhile, issuing a release, the Presidential Special Task Force states individuals who are unable to collect their pensions on the 2nd and 3rd of this month can alternatively obtain their pension payments tomorrow.
The novel coronavirus, also known as COVID-19, has infected more than 1.2 million people and killed more than 64,000 worldwide. Meanwhile, the number of confirmed cases of COVID-19 continues to grow in the US, with more than 311,000 recorded cases have been confirmed thus far. The coronavirus has affected 206 countries and territories around the world and 2 international conveyances at present. The USA has recorded a total of 311,637 confirmed cases in the country, with 8,454 people dead, reporting 1,344 deaths yesterday, the country's largest single-day death toll. New York State's coronavirus death toll has risen at a devastating pace to reach 3,565, up from 2,935 the previous day, the largest 24-hour jump recorded. In Europe, the number of deaths in Italy from the epidemic rose by 681 to 15,362, a relatively low rise compared to the recent days. The total of patients in the intensive care in Italy is at 3,994, down from a previous 4,068, the first time the total had fallen since the outbreak of the epidemic in northern Italy. The country's total confirmed cases has risen to 124,632. A further 809 people died in Spain yesterday, bringing the total in the country to 11,947 deaths. Spain's confirmed coronavirus case tally reached 126,168. The country's confirmed cases surpassed Italy later on the day, making Spain the hardest hit country in Europe and second only to the United States worldwide. Germany's coronavirus death toll has risen to 1,444, with an increase of 184 deaths yesterday. The total number of confirmed cases has risen by nearly 7%. Germany now has 96,092 coronavirus cases, an increase of 5,936 in 24 hours. The number of people who have died from COVID-19 in France climbed to 7,560 in the country thus far. France has recorded a total of 89,953 confirmed cases, with an increase of 7,788 cases as of yesterday. The number of COVID-19 cases in Iran, the hardest hit country in the Middle East, soared to 55,743 thus far, while the pandemic showed signs of slowdown. The death toll in the country has increased to 3,452, recording 158 deaths yesterday. With an increase of 529 cases in the last 24 hours, the total number of positive coronavirus cases rose to 3,588 in India. 99 deaths have been reported in the nation so far, with 229 people have recovered in the country.
China held a national mourning ceremony yesterday for martyrs who have died in the new coronavirus outbreak, flying the national flag at half-mast across the country. China has recorded 81,639 confirmed cases, with the death toll reaching 3,326 thus far. 76,755 patients have recovered from the virus infection in the Chinese mainland.
China on Saturday mourned the thousands of people who've died in the new coronavirus outbreak. The national flag flew at half-mast throughout the country and all forms of entertainment were suspended. At 10 a.m. Beijing time, the country observed 3 minutes of silence. Cars, trains and ships sounded their horns. More than 3,300 people in mainland China have died in the epidemic. In Wuhan, the epicenter of the outbreak, all traffic lights in urban areas turned red at 10 a.m. and all road traffic ceased for 3 minutes. More than 75% of the country's fatalities were here in this megacity of 11 million people. Among those who perished was Li Wenliang, a young doctor reprimanded by police in Wuhan for spreading, quote, false rumours when he tried to raise the alarm about the disease. Li Wenliang was a hero, this man says. He found out about it early, but now it's too late. Since then, the virus has spread around the world, infecting more than 1 million people, killing tens of thousands and paralysing the world economy.
The UK government has extended its condolences to the family of a 5-year-old child who died in hospital after being infected with the novel coronavirus. In total, the United Kingdom has now confirmed 41,903 coronavirus cases, recording over 3,700 cases within the past 24 hours and 4,313 fatalities.
Ambulances arrive at Britain's newest hospital, built in under 2 weeks and ready to treat hundreds of coronavirus patients. On Saturday, news that a 5-year-old child with underlying health conditions died in hospital in the UK after being infected with the novel coronavirus. The child is among a further 708 people who've died with the virus here, bringing the country's fatalities to 4,313. At a news conference, Cabinet Office Minister Michael Gove warned people to stay indoors.
And some will be tempted on this sunny weekend to venture out and about. But, as the Health Secretary underlined yesterday, if we relax our adherence to the rules, we increase the risk for others.
Britain's Health Service Medical Director said it will take a week or two before Britain's social distancing measures start to translate into lower hospitalisation rates. But London has plateaued slightly in recent days. And on Saturday evening came the news that Carrie Symonds, the pregnant fiancée of Prime Minister Boris Johnson, had spent the past week in bed with symptoms of the virus. Johnson said on Friday he was remaining in isolation with mild symptoms of COVID-19.
Now, as you are at home these days, you could also involve yourself in home gardening. The opportunity is also available now to obtain the contribution of your siblings as well for this task. Here is a method on engaging in collective home gardening. Home gardening has been a salient feature of the economic system of the country in the olden days. Consuming what is grown in one's home garden is vital in ensuring good health and saving on expenses. Urban residents are now also focusing on crops that can be grown at home. The Vaga Palalla initiative is a method in which home gardening can be done in rural and urban areas. In order to prepare the Vaga Palalla, a piece of gutter or a bamboo of 2.5 feet in length needs to be obtained. The two ends of the gutter or bamboo need to be closed to prevent the fertile soil that is to be filled into the gutter or bamboo from spilling. Tiny perforators should be made at the base to prevent waters from stagnating. In order to hang the gutter or bamboo from a height, 4 holes can be drilled along the top. Thereafter, seeds can be planted. Many gutters or bamboos can be utilized in the same manner.
Several Sri Lankan inventors have designed several types of equipment beneficial in containing the spread of the coronavirus in the country. Here are some of these inventions. An engineer by the name of Madhur Disanayaka, together with his staff at the Mass Intimate Organization, has invented a robot which can assist in the treatment of patients. The robot was gifted to the Valikanda Hospital, which is specifically treating COVID-19 patients today. The robot is able to distribute drugs, food and leaflets with guidelines amongst the patients and staff. The Biomedical Engineering Unit of the Kantale Base Hospital has invented a new disinfecting machine and 15 hand washing machines. In addition, manufacturing face masks and personal protective equipment is also on the way. At the Gampaha Cooperative Hospital, Dr. W.A. Nuan Kumara has designed another disinfecting machine. This device is significant as hands can be sanitized without the use of water. The inventor states as the device dispenses small amounts of disinfected fluid, it is cost effective. Port City Colombo has donated protective gear worth 6 million rupees for the personnel attached to the police and the Manning wholesale market in Petta today. Supporting the government's efforts to combat the COVID-19 outbreak, Port City Colombo took this initiative to ensure the safety of the personnel engaged in providing these essential services. In addition, another donation will be made next week to the Health and Commerce Ministries to be distributed among hospitals and those engaged in essential services. More donations to the Triforces and frontline workers will follow. The workers at the Manning Wholesale Market received the donated items in the presence of Colombo Senior DIG Deshabandhu Tennakon and senior officials of the Port City Colombo representing its Managing Director Jiang Huleng. Recognizing the service Manning Market provides in the daily distribution of fresh produce to Colombo populace, Port City Colombo took this initiative to ensure that the people providing these services are protected.
And in news from overseas, an Australian state launched a criminal investigation today into how thousands of passengers were permitted to get off a cruise ship in Sydney last month, despite many experiencing flu-like symptoms.
Thousands of passengers were permitted to get off this cruise ship in Sydney last month, despite many experiencing flu-like symptoms. Now, an Australian state's launching a criminal investigation into how that was allowed to happen. Nearly a third of Australia's deaths have been attributed to Carnival ship Ruby Princess. On March 19th, the liner was allowed to disembark passengers at Sydney's Circular Quay. Many later tested positive for COVID-19. New South Wales Police Commissioner Mick Fuller.
There is clear evidence that Corona-19 has been brought off that ship. There's clear evidence now that when it stopped in New Zealand that Corona-19 has come off that ship.
The ship's currently stationed off Sydney's coastline, where crew members have been tested for the virus. Australia has 5,687 confirmed cases as of Sunday afternoon, with the death toll rising to 34.
Programs to relieve the mental stress of residents in housing schemes are underway with the support of the police and the security forces. Through these programs, awareness also raised on the health guidelines that need to be followed to safeguard against the COVID-19 virus. Such programs took place at the Edmonton Housing Scheme, at the Kirlapana and Sahaspura Housing Scheme at Boralla yesterday. The programs commenced with a religious program, after which health guidelines were briefed and a cultural program took place. The Sri Lanka Army organised a musical show opposite the Havelock City condominium this afternoon. The Army band performed together with Bhathiyan Santosh, Umaria Singamansa and a number of singers. Army Commander Lieutenant General Shavendra Silva and a group of invitees were also present. Well, that's all the news we have for you tonight. The national news broadcast will return tomorrow, and until then, a very good night to you all.
Good night.